So what we're going to talk about today is just very basic stuff about shelters and shelter medicine. What I want to try to do, how many of you have ever worked in shelters or volunteered in shelters? Great. So for some of you, you're going to probably know a lot of this, maybe not all of it. And so what I want to try to do today is kind of get everybody up to speed, up to the same place in terms of just understanding, what is a shelter anyway, and what do we do when we're doing shelter medicine. Want to make sure that you guys are aware of sheltermedicine.com. This is the UC Davis website currently, but we're going to be co-branding that and collaborating. So that's going to be the UC Davis web resource. And so I just want to make sure you guys are aware of it. There's tons of information there. So we're going to do an overview of animal shelters. And what I wanted you to see, this is Wisconsin Humane in Ozaukee, Wisconsin. This is a tiny little shelter down south. This is my foster home. This is a shelter in The Hague in the Netherlands. And I just wanted to sort of say, there's so many different kinds of shelters out there doing so many different kinds of things. And what I want to do today is just kind of cover and touch. That's all we can do in about 50 minutes. But just cover and touch on a little bit of what those shelters are doing and what that even means when we're talking about what a shelter is. So if we look back to animal protection back to like 1866, the reason that we go back here is that that's when Henry Burke founded the ASPCA. And the RSPCA was already going in England, and he had been to England and visited and seen the RSPCA. And what Henry Burke was really strongly affected by was scenes like this that he was seeing on the street where horses were being beaten and worked so hard. And he was very, very interested in this idea of supporting and protecting animal welfare. Animal welfare at the time was very closely tied also with child welfare, and still to some degree does. And there was a very famous case here of this girl, Mary Ellen Wilson, that sort of became part of this whole process of starting this focus on animal welfare. This is a picture from 1877, right around the same time, and hopefully it gives you a pretty good picture of this is what animal control was like in 1877 in New York City. They went around and they collected the dogs and they put them in these giant cages and they drowned them in the river. Because that was all they were really thinking about, is how can we get dogs out of the city. Only just that part of protecting human health was really their primary concern. Things have gone a long way since then, and at that time when the ASPCA was founded, Henry Burke was not particularly interested in having a connection between animal control and what he envisioned as animal welfare. 100 years later, after his death, actually, so a little bit later, the ASPCA actually took on that role of working and doing animal control in the city of New York. So that came together. And then, 100 years after that, in the 1990s, they split again. And so now, again, animal control and animal welfare was separated. But what we see now is that lots of organizations are working together, and that's what I'm going to talk about. So who is taking care of homeless animals in the United States? There's no umbrella organization, and that's what a lot of people get confused about. So they hear the ASPCA and they think that's covering every organization that ends with SPCA, but it's not. The ASPCA has a shelter in New York City, and other than that, they do all sorts of work all around the country, but they're not an umbrella organization. So if you hear the San Francisco SPCA and you hear about the Richmond SPCA, those two organizations aren't related just because they're using that SPCA number. It's just the Society for the Protection of Animals, and any sheltering organization can use that if they want to. So there can be shelters that are the public or government shelters can do it, private nonprofit shelters, rescue groups, and foster homes. are becoming more and more a part of what we do and what we mean when we're talking about sheltering, and I'll come back and talk a little bit more about that later. National animal shelter advocacy groups, and that includes things like ASPCA, HSUS. We're going to come back in just a second, and I'll sort of show you the list of those. There's over 9,000 groups, and the estimates are between 4 and 8 million animals being cared for by these groups. Hopefully you're recognizing 4 to 8 million is a pretty broad estimate, right? We don't really know where in that range we are, but we're working to try to figure that out. There is still little or no regulation in many states of these kinds of organizations, and that can be really problematic. We'll talk about it, but in some ways it actually creates some nice opportunities for the field to self-regulate. There is a growing sense of structure and standards in the field, which I think is really very exciting. And one of the things that's kind of cool is I give this presentation every year, and I kind of update it and change it every time before I give it. And this is the first year I really wanted to add this statement, because I think it's really true. There are many states now that are requiring shelters to report their data. There's some states that require inspections and have guidelines that outline what shelters should do. There's many shelters that are using the guidelines document. I'll come back to that. So that's all pretty exciting. There's supporting national organizations. There's a whole list, and this list grows every year. These are organizations that work as funders. They work as thought leaders. On this side, we mostly have funders. On this side, we tend to have sort of associations. So the ASV is the Association of Shelter Veterinarians. NACA is the National Animal Control Association. SAWA is the Society of Animal Welfare Administrators. And then the National Federated Humane Societies. Shelter animals count we'll talk about a little later in the course, probably. So what is a shelter? Again, we said there's all these different agencies, but a shelter can be municipal animal control. So, and we'll come back to that. It can be a private humane society. They can be a rescue group, foster home. We mean all of these things whenever we're talking about a shelter. And sometimes we're going to focus on one particular thing. Like we may have a very specific focus if we're talking about a network of foster homes. And our focus might be very different if we're talking about an animal control facility. What's really fascinating to me is in terms of animal health, there's usually not that much difference when we're talking about the real basic foundation of what they need to understand in order to do that. Live release, so in order to save lives and release animals alive, that's where we start to see some differences. And we also see sometimes these different shelters have really different strategies or really different missions. And if they're trying to do something very different, we're not going to try to apply a one-size-fits-all approach to that. So it's important to really be clear about what to expect. And I wanted to include these pictures. This is actually a picture from Australia, just to say, I think a lot of the time we think of a shelter as going to look like this, but it doesn't have to. A shelter can look like this. And more, we see things like this when we're talking about a shelter where there's people caring for animals in their homes that they plan to adopt out after they've been rescued. So public or municipal shelters are usually run by a county or a city, and their mandate is to control stray animals and enforce laws. They usually fall kind of under public health. Sometimes we see them under the sheriff's department, under the sanitation department, public works. We see them stuck, not randomly, but we see them sort of listed in all sorts of different places within the governmental structure. Historically, their number one priority has been public health protection. But we see more and more that there is increasing focus on animal welfare, life-saving, adoption, and working with transfer partners as their mission. There can be a really broad range of sort of quality of the facility, especially I think in animal control, but really all over sheltering, where we see some animal control facilities. This is Jacksonville, Florida, where you can see like they've just built a very nice new shelter. So lots of shelters are sort of turning over. There's a lot of shelters that were built like in the 50s and 60s and 70s. Those shelters are hopefully getting kind of turned over. Private shelters are usually nonprofit groups, 501c3. They house domestic animals. Again, they can be called an SPCA. They can be called a humane society. They may not have any kind of name like that at all. It may just be, you know, Helping Paws. It may be any name they want. Some of them are sanctuaries, some are adoption agencies, some are full service shelters, can be open admission, closed admission. We'll come back and talk about some of those terminologies. Rescue groups and foster homes. This is what I wanted to show you guys because I think it would be interesting. I know you guys are kind of interested as a club, but this is a group of students from UC Davis that actually put together a foster network of their own and worked on that. Rescue groups can be species focused, breed focused, age. They can have any kind of niche, and there's lots that do. Like you'll find like the diabetic dachshund rescue, and you also find some, which is really interesting, where their mission is just to pull animals out of Chicago Animal Care and Control, or just to pull animals out of Matic. So they've got lots of different focuses. And again, it's really important if you're working with that organization to understand what their mission is and hope that you can encourage them to be sure they understand what their mission is too, because a lot of the time understanding what their mission is really helps them be more successful. So again, we can see these things being just a single home. We can see them being a network of homes. The other thing that's really important, especially in this category, is for those of you that are planning to go into private practice, but you're kind of interested in shelter medicine, or you really want to help shelter animals, so many of these groups rely on private practice veterinarians and establish really long-standing relationships with private practice veterinarians. There's even a fair number of private practice veterinarians who make a fair amount of their business from working with these rescue groups. And so that's really important to keep in mind. Sanctuary is again, a viable kind of shelter. Some shelters are set up, and the idea here is that they're planning to hold those animals for life. They're not planning to adopt those animals. It doesn't mean that they never do, but the plan is. This is a sanctuary that I worked with in New Jersey. And they had cat TV in every room, and the cats would play, and they would pull animals out of large animal control facilities and then hold on to them and then mix them into their population. And they did a very nice job of being able to do that and do it well. There's an increasing overlap, though, with some shelters with this idea of sanctuary and then kind of just getting into being a sanctuary by accident. And so that's something that we really want to be careful of. That kind of lack of clarity over function can cause a huge problem, because hopefully you can appreciate there's a huge difference in quality of life for these cats than there is for this dog, that we wouldn't want to have that dog live in that kennel as a sanctuary forever, for the rest of his life. Shelters have all kinds of different functions. Again, so we talked about, well, there's municipal animal control, private. They can do stray animal rescue, capture, and care. That's not limited just to animal control facilities. Many private shelters do that. Many rescues do that as well. Law enforcement, again, even some private humane societies will have certified humane officers who work in their facility. They can respond to nuisance calls, rabies, animal cruelty. Some shelters allow animal surrenders and some don't. Some are focused just on strays, and some won't take strays and will only take owner surrenders. So it's important to understand, again, what their mission is, what they're trying to do. And animal adoption, though most people think of this as kind of an integral part of an animal shelter, some shelters don't do adoptions. and it's fewer and fewer, but either they're planning to be a sanctuary or they only do live release through transfer to other groups. They don't do adoption. So that's something, again, just to know what's happening in the organization that you're working with. Shelters also have volunteer programs, low-cost spay-neuter services, very vibrant live release programs. This varies. Partnerships and community collaboration. Many shelters do humane education, behavior training, low-cost spay-neuter, sorry, I already said that one, low-cost vet services and outreach wildlife rehab, and cruelty investigation as well. It's important to, when you're looking at a budget or thinking about how much money that shelter is spending and how much money that shelter needs to raise, to really be aware of like what are all these functions that the shelter has signed up to do and understand how they're budgeting their resources into each of those programs and where all those programs, again, come back and fit into the mission of the organization. So the other big thing, and this is growing more and more and is really a fun place to work in this field, is where there's these public-private partnerships. Sometimes we see just a private shelter, and the Dane County Humane Society here in Madison is a very good example of this, where it's a private shelter. It's a nonprofit organization that has a contract with the city and the county to hold their stray animals there, and then they take those animals and try to adopt them out after they've done that stray holding. Sometimes we see a private auxiliary group that works with a public shelter to do fundraising or provide other kinds of things. Chicago Animal Care and Control is a really good example of that. They have a very active group that's the Friends of Chicago Animal Care and Control, and they can do different things because they're not a municipal organization. They're a nonprofit organization, and they're associated with that shelter. Veterinary clinic and shelter partnerships, again, are quite common and often can benefit both, and so that's something I really want to stress, that a lot of the time veterinarians will think, oh, the only way I can help a rescue would be to just give away free services. And most rescues have a budget, and so while many veterinarians will offer discount services, it doesn't mean you have to go broke trying to work with a rescue group or help a rescue group, that there's lots of ways you can provide support and service within the context of their budget. I always like to show this just so you can get a perspective when I'm talking about that there's a large variance in this field. These are all different shelters, and you can see, you know, their intake and then their sort of budget per animal. And they're not necessarily related. It's related to how many programs there are going on. I like to think of it as kind of a degree of difficulty. Some shelters work with animals who are more difficult to either find placement with or to rehabilitate in order to get placement. So we're not going to go too much into detail with this, but just so you can get a sense, there's a huge variance in terms of percentage of animals released alive out of intake. There's a huge variance in terms of how much shelters spend to do that, and then there's also just a huge variance in terms of how much money per animal that organization has in their budget. Terminology can be a really tricky thing in this field, and so I'm going to just kind of introduce some of these. I can't necessarily define each of these for you, because the point is you need to have a good idea of how someone is using these terms when they're talking to you. So they may say it's high turnover or low turnover. What you probably really want to know is, well, what's your average length of stay? And we'll come back and talk about that. Or what's your annual intake and what are your annual live releases, so we can have a better understanding of what they're talking about, because high or low could be really relative, right? Maybe relative to the other shelter in your town, you're high turnover, but relative to a shelter in the Central Valley of California, your turnover is fairly low. And so we like to be careful about the way we use this. We hear full service quite a bit, and I'm always really wondering, you know, what exactly does that mean? And so again, it's important to think about, well, what do they mean when they say that, or to ask, what do you mean? I think a lot of shelters think of that as being that they are open intake and they have humane education and they handle strays and they do adoption, but we don't know what they mean unless we ask them pretty specifically. Open admission or limited admission. What open admission usually means, if an animal comes to them, they will take it. Open admission doesn't necessarily mean that they take it without an appointment, but sometimes that's what's inferred. And then when they start scheduling appointments, we start to call it managed intake. Not necessarily, so you always want to ask what it is they're talking about when they're saying that. Limited admission usually means that they're controlling and selecting which animals they'll take in and which animals they won't. Adoption guarantee usually means that they're able to find an adoptive home for every animal that's either in a category of being healthy or treatable. And so that's, again, a trickier term because we need to find out exactly, well, what is that guarantee? What does the guarantee mean? No kill can mean a very, very wide range of things. Some people say, well, that means that you're adopting out over 85% of the animals. Some people say it's adopting out 90% of the animals. Some people think it's adopting out even more than that. The general idea is, of course, that we're all working to get to no kill, that nobody wants an animal to come into a shelter and die just because they didn't have a home to go to. And so that's kind of the overarching idea with no kill, but again, definitions can really vary and connotations can vary even more when people are using those terms. There's increasing efforts at definition and making productive alliances rather than using terminology to drive our field apart. There's really great interaction right now where everybody's really trying to find ways to come together. No matter where you look, no two shelters are quite the same or totally different, no matter how you're describing them, and that's a good thing in a lot of ways, but it can also be really interesting to see how similar they are and how you can apply so many of the same ideas and same sort of structural principles to all of them. So going back to our little history, so we went along, and then now in the 70s and 80s, 1970s and 1980s is when the idea of really professionalizing animal sheltering first became sort of a thing at all. And Phyllis Wright was one of the first people who thought about doing that. And one of the reasons that this came up was that people wanted a better way of euthanizing animals and ensuring that when they were euthanizing animals that that was a humane process. The other thing is that people who worked in shelters were often kind of stigmatized. And so there was a lot of work that started around this time with SAWA and NACA. HSUS started Animal Care Expo, and so when this all started, the idea was, can we bring up the field? I think it's really interesting to see, again, when we look at statistics, we have to always take them with a grain of salt because we've not really successfully collected solid data for animal shelters yet. But we know that this is in fact true, that we see this decreasing curve of euthanasia per 1,000 people, and that's really exciting if we look back to the 70s when this kind of push to professionalize started. As I said, there's many things that kind of just keep coming up in lots of different places. Panleukopenia is one of them, and managing outbreaks is something that we spend a lot of time doing as shelter veterinarians. And sometimes we get kind of unexpected challenges. I don't know how all of you feel, but when I was in vet school, we were all kind of worried about distemper because we're in Wisconsin and we hardly ever see it. And so lots of people were feeling like, oh my gosh, I'm going to graduate from vet school and I'm not going to know what distemper looks like. The truth is distemper can happen anywhere. And we've had now in the Midwest, we've had a large distemper outbreak in a shelter in Chicago, and this was a large distemper outbreak in a shelter in Milwaukee. And both of them were originally missed because veterinarians here are just not used to seeing distemper, so they were just diagnosing other things. Where if those same dogs had turned up in the Southwest somewhere, a vet probably would have been much more readily thinking about that. There are more subtle challenges to these kind of outbreak things, and this is a movie some of you may have seen before. It's just a really short little video clip of a kitty, and we'll come back around probably and talk about this some more, but think in your mind, what do you think? What can we say about this situation with this kitty? What's wrong with this picture? Anybody? He's bored, and then somebody said the cage is small. How do we know the cage is small? Yes, we can compare it to the size of the cat, right? He can barely turn around. What else can he not do? He can't get away from his litter box, great. He can't stretch, so he can't stretch to his full body length. Think of what that would be like to live all day. Like if you went to a hotel and you got into your hotel room and you couldn't ever put your arms over your head. Or you couldn't even stand all the way up, right? And for him, the other really important thing is his tail. What's important to a cat about his tail? Communicating, I heard somebody say, right? So he's trying to communicate. It's actually feeding time, and he's trying to give a positive show, a positive behavioral show. But every time he does it, he's getting negative feedback. The cage is saying, don't do that, don't do that, right? And so we don't want that to happen for him. And that's going to lead to a whole world of problems. So we, just want to, there's these like kind of big challenges. We think about outbreaks, we think about that. And then there's these little, much more subtle challenges that to us at this point don't feel so subtle anymore. This is another really shifting challenge where what we see more often, or there's a growing number of cases where there's a person or a group who's identified themselves as a nonprofit shelter, and they are charged with animal cruelty. And so the question is, what we don't know is it a larger number of shelters creating animal hoarding situation, or are a larger number of hoarders calling themselves shelters? This may be all very wrapped up together, but these are two individual cases from Wisconsin, very close to home. And so we see this happening, and it's something that you really need to be aware of. And when you're interacting with the shelter, it's an assessment that you really want to be making. Is this a shelter that I want to work with? Is this a shelter that needs an intervention? What's going on in this situation? Since we're talking about challenges, I couldn't leave this one out. This is one that is just getting launched. It's a UC Davis and a University of Florida effort called the Million Cat Challenge, and the goal is to save 1 million lives in 5 years, and there's shelters all over the country signing up to do it, and it's really exciting, and you will hear a lot more about this from Kate Hurley, who is coming to talk to you just about this project, because it's very, very exciting. So now anybody have questions about shelters? We're going to move into talking about shelter medicine now. Yeah?
When you say livelihood use, what does that include besides like adoptions?
It's a great question, and we'll talk a lot about that next week when we talk about capacity for care. But what we're talking about usually is adoptions, transfers to other groups, return to the owner. So if a stray dog comes into the shelter, but the owner comes and gets it, that's a live release. It could be, there's lots of programs now we call shelter neuter return, where community cats show up to the shelter and they're spayed and neutered and put back where they came from. So that's another form of live release. Any positive outcome. Some people call this, when we go back to terminology, some people call this going out the front door. So anything where you're leaving the shelter in a positive way. So why should we be involved in shelter medicine? And I think for me, this is a really important and sort of dramatic concept to me. There's no malady, there's no cause of mortality that comes anywhere near even touching the morbidity or mortality associated with homelessness in animals. And so yes, veterinarians really need to be involved in this. And when we talk about sort of professionalizing the field of sheltering, the involvement of veterinarians, which is one of the things I really want you to see actually in the Maddie's Fund video, the involvement of veterinarians has been really essential to bringing that field up. When I first started working in animal shelters in the 1980s, it was really hard to find a veterinarian who wanted to come and be involved at the shelter. And even when I could find some really nice person, when they got to the shelter, often they really didn't know what they were doing. They really didn't know what a shelter was like. And they really weren't practicing population medicine. They could come in and treat each individual animal. But they often had a very hard time if we had questions about, like, well, why does everybody in this whole room have diarrhea? You know? So it's a very different field, and it's really exciting to have veterinarians more involved in it. Animal homelessness creates financial and emotional costs. It creates public health risk. I'm a mom. I didn't take this picture, but this picture was taken in a shelter that was having a salmonella outbreak. And there were signs all over the shelter saying, "Don't handle the cats," you know, and here's what happened. There's huge potential for animal suffering and death on really a massive scale in sheltering. The converse is also true, so I don't want to leave you like, oh God, sheltering is so awful, because the converse is true too, that there is this possibility for unbelievable life-saving and, you know, rehabilitation and so many exciting things in animal sheltering as well. The scope of the problem can change rapidly, and I just wanted you to see this. I'm doing a consultation with the shelter, the animal control shelter in Chicago. Dr. Balanoff is doing it with me, and this is like a dream come true. This is the live release rate for cats as a percentage of their intake. So if you look, you can see their intake hasn't changed a whole lot. But look at the amount of animals that are being released alive. So from 35% in 2011 to almost 75%. Just astonishingly great. You know, like, and this is for 10,000 cats a year about. So that's a really dramatic change, and sometimes I think people just can't believe that things could turn around so quickly. You hear 4 to 8 million animals going into shelters every year. That can change. And I think having veterinary involvement helps to make that change. So how do veterinarians work with animal shelters? They can work as board members and advisors. They can work just on as needed, either doing outpatient services or doing shelter visits. There's a vet practice up near La Crosse, Wisconsin, that rotates through. One of their clinicians is always on shelter duty, and they go to like 3 or 4 different shelters, and the others are all seeing their private clinic, their private clients. You can do surgery, spay-neuter surgery, part-time or full-time staff. You can be in a leadership role nationally or with a particular shelter. You can go into academic shelter medicine, and many veterinarians actually even go on to become shelter directors. So there's lots of different ways that veterinarians are working with shelters. This is the Shelter Standards Task Force of the Association of Shelter Veterinarians, and I will introduce you guys to the Guidelines for Standards of Care. And this is the group that actually work together. It's 14 veterinarians with about, gosh, probably over 100, maybe over 200 years of experience amongst all of us in working with animal shelters. When we're thinking about shelter medicine, what we're thinking about is really all of this, and I'm not going to go through every single thing that's on the slide, but just to sort of say there's all these different sort of inputs and outputs that we're working on, and basically we do research in these areas, we communicate to the people who are doing the work, and they're putting all of these things into action, and then the end result is that animals don't suffer or die because they're homeless. And so this is this very complicated system. The other thing that happens is that the community begins to build trust in the animal shelter, and then more lives are saved. And so we can see this kind of positive cycle that comes out of all of these inputs. And the other piece of it is, as all of these inputs are going in, the shelter uses its resources more wisely, and then that, again, sort of feeds into that positive cycle of more animals being saved. Shelter veterinarians do lots of individual treatment. This is a little kitten that we fostered. Some communities probably wouldn't have the resources to be able to treat a kitten like this, but once you have foster care and and you're using your resources efficiently and you've controlled your intake to a certain degree, you can do it. And the reason I like to include him is to just sort of talk about how inspiring a story like this can be. And so this little kitten had more fractures than you even want to know about, and couldn't really use his back legs at all. And so he spent most of his time just laying around on the towel. And my son said to me, you know, Mom, you really need to give him a toy. I said, honey, he can hardly move. And he was like, but he's a kitten, he really needs to have a toy. And so he convinced me that I needed to hang up this piece of vet wrap, and he did it, and the kitten just sat there, batting at this thing, because kittens are kittens, and that can be a really inspiring thing. And so that kind of individual treatment can just feel great, and that's a huge part of shelter medicine. It can also really pay off for an animal shelter. This is a story from the MSPCA where they had heart surgery on a dog, and after they did the heart surgery, they had a little girl who had a similar heart condition and a similar surgery, and they took the puppy, the girl, onto a TV show, and they raised over $50,000 to go into one of their kind of Help Me Heal funds. And that's an incredible leveraging of something that I'm sure they wanted to do anyway. And so it's really, these are important things to think about. We do a lot of shelter health management. That's, so we've got this individual treatment, we've got shelter health management by, reduce and manage intake to what's really beneficial, how to use resources efficiently, maintain animal health and welfare while you're in the shelter, find good homes for adoptable animals, educate, provide a humane outcome for those that you can't adopt, and then also this really big piece of protecting the public and animal community health. There also are these really, really big payoffs. This is a shelter. This is a shelter in Las Vegas that we worked with, and the first time we went to the shelter, it was just a horrible, horrible situation. And like I showed you, things can change really rapidly. Just a year later, we went back and we found happy pets. We saw animals moving through to adoption. And this is kind of one of those payoffs as a shelter veterinarian. You can treat an individual animal, and that's inspiring. You can work and treat a shelter that serves 50,000 animals a year and make things better for 50,000 animals a year. And that can be really inspiring. So that's, just something to think about. This is a letter from a veterinarian. She says, I'm in the process of implementing strict disease control protocol that I believe in 100%. In the process, I'm upsetting staff, volunteers, and I have to please the media. I'm very well supported by my director and some of the managers, but my daily decisions of life and death are upsetting so many lay and non-lay people. What can I do to help this situation? I hate to make people upset, but I'm trying very hard to stick to my guns and beliefs, and I'm starting to have a poor sleeping habit due to the stress of upsetting people and making the tough decisions. Any suggestions or words of support? And the reason I have this is like the other big payoff is that I think having veterinarians to support veterinarians has really changed the field pretty dramatically. And when I very first started in the field, I would see people who are interested in shelter medicine go off to work at a shelter and get so frustrated and feel so strung out on their own. And now there's all these networks of veterinarians to support other veterinarians, and it makes all the difference in the world. So that's really encouraging. Wanted to just briefly let you know there is a massively increasing demand in the field of shelter medicine. I know probably 10 different shelters right now that are contacting me on a regular basis to ask if I know anybody who really knows what they're doing in a shelter that they could hire as a veterinarian. There's really a very wide array of opportunities. The pay is commensurate. A lot of people think like, oh, if you went to work at a shelter, you wouldn't make a reasonable amount of money, but the pay is really very, very similar to positions in private practice. Good benefits. One of the huge benefits often is that you get more regular hours. It's challenging and incredibly rewarding work. If you ever want to look and just see kind of what opportunities are out there, the ASV has a posting place for jobs, and it can be great to just look through and see what's out there. Again, as I said, there's people working in private practice with shelters. There's people doing mixed private and shelter, spay-neuter, consultation, national outreach, and academic opportunities. There's internships and residencies. I'm hoping next year that we'll have 2 internships. I'm almost certain that we'll have at least 1. We're also hoping we'll start a resident at UW next year. There's some programs that have either fellowships or master's, PhD programs. University of Wisconsin and UC Davis have a fellowship program, and we have somewhere between 3 and 5 fellows every year. And there's all sorts of opportunities for academic research. You can see how much fun it is. These are all former interns and residents. Some veterinarians work just doing mobile service as a means of working with animal shelters. There can be either a truly mobile clinic where you take your clinic and you go on the road, and people do that both for spay-neuter as well as for sort of consultation, doing medicine, helping with the shelter, and many people combine those. There's some where they take a whole vehicle with them, and there's some where they kind of use a MASH style approach to doing that. And then the other is the reverse, where they go out and they collect a bunch of animals and they bring them in to the clinic, to a freestanding clinic, and Humane Alliance is a really good example of that. The Association of Shelter Veterinarians has over 750 members. I'm not exactly sure how many now. I think it's fairly well over that now. And there's student chapters at most universities, at most vet schools. They provide continuing ed at most major conferences. And the really big news is that the board specialty is in progress. The first exam will be this fall. In 2015 will be the first exam for the board specialty. Everybody's already putting their credentials in now, so that's a really, really exciting thing. So what do? We're doing individual animal treatment, population medicine, vet student training, shelter staff training, continuing education, specialist training, and then really developing the field, because it's such a new field that we're always kind of putting the field together as we go, and that has also been very exciting to sort of be part of that. So shelter medicine involves questioning everything, which is, I think, for people who are really intellectually curious, so shelter medicine can be very fun because we're always asking that kind of, really? Does it really have to be that way? So, oh, okay, shelters are open intake, and that it has to be that way. And then we say, well, why? Why does it have to be that way? Is that really the best thing? Sometimes we'll even go as far as saying, is sheltering at all even really the best thing? Maybe there's another alternative to the way we're approaching this, and we're always asking those questions and solving those problems. It's really interactive learning, great opportunities for hands-on experience, especially as vet students. It involves a lot of sort of social study, human social study, along with medicine, which is very gratifying experience, and can be a frustrating experience too, to sort of say, oh, why won't these people do this differently? I really want them to treat their dogs differently. How do I get them to think about this the way that I think about it? And what you really need to do is really understand how they think about it, and then see if there's a way that you can solve that problem. Incredible opportunities for collaboration, and I think one of the most satisfying things in doing consultation that I find is being able to empower the people who are in a situation where they're frustrated or feel not empowered to make things better, but to give them the tools that they need to be able to affect the change that they've wanted all along. So here's the ABVP. Our specialty will be under the ABVP, and if you want to learn more about it, you can. There's both a residency and a non-residency pathway to that. Bottom line, for shelter medicine, you can save individual animals with a relatively small investment, but it feels great. Help even more by identifying and managing outbreaks. You can help even more by being preventative in your approach both to health and management. can solve underlying problems by this sort of questioning attitude, and you can empower people in communities to take better care of animals now and in the future. This is a little dog who is in Las Vegas, and I think about this little dog all the time, knowing that we can change things, we can make things better, and that's exactly what we want. Thanks to Maddie's Fund for the support for this course. They are also the ones that are going to be buying you lunch every Thursday, so we should thank them. At the end of the course, we usually try to send them a really nice letter to thank them for their support. And then I just wanted to include these resources. There's lots of resources out there if you want to learn more about shelter medicine.